Folks, thank you so much for coming. And while you finish up your meal, I'm just going to get things rolling a wee bit. And I'd like to give you a quick overlay of what we're doing and why. Um, I think this is really all about resilience in community. So, resilience I consider to be the capacity of an individual based on physical, mental, and spiritual health to respond to challenges in life. In community, what individuals do as a group when confronted by a broader challenge. And what we see day in, day out in the headlines are challenges that we're all aware of. If you're Angel or Susie or John or Donna or most people in the room, you worry about the interference of foreign governments in Canada and in democracy. If you are related to people in Europe or just care about world peace, then you get overwhelmed by the news about the war in Ukraine. And these are big, huge kind of crises that dominate our mental energy. The pandemic was another one. What do we do when Canada is confronted and the world is confronted with something so completely new? So below the surface, when person's resilience is being eroded year after year and day after day, when community is being undermined consistently through the trends that we are confronted with in Canada, we don't notice. We don't take arms against the sea of trouble and by opposing end them because they're not so dominant in our lives. But what I have learned is that the most insidious type of crisis is the one that keeps growing and keeps unfolding. And so that's what we're talking about. You may imagine a big event in your life where you confronted some huge challenge, where you were up against it, and resilience and community made a difference. I think of my experience in Burma in, I guess it was 1983. I got the worst case of food poisoning you can imagine, ended up alone, lying on my back, severely dehydrated, no community around me. And I was fortunate to get through that. There was some resilience, and I was nursed back to health with some Mandalay beer because you couldn't drink the water. That was one event in my life I can think of. Another, when I lived in Taiwan, borrowing a bike from my friend Matt Park one Saturday morning and grabbing the bike off the garage wall where he had supported it and riding up the incline of his driveway to Yangmin Mountain Road, which is a really steep mountain road that goes about 5K. And as I got moving, tested the rear brake, no response. And I'm thinking, that's odd. Tested the front brake, no response. Matt hadn't put the brakes back onto the bike. So I was going down this mountain. There was no stopping. And it was a matter for me of when, not if, that fatal collision was going to happen. And I kept looking, okay, should I bail here, bail there? And, thanks to God's grace, I got to the bottom of the hill. I was able to put a foot down finally, but you couldn't repeat that exercise. And my Taiwan friends will tell you that's a steep mountain ride. There was some resilience there. There was no community. I was alone on my bike. And then maybe more relevant to you is the pandemic experience. So there was a day in April of 2021. I was a candidate for election. I visited Ottawa, met with the, then we thought, future Prime Minister of Canada, Erin O'Toole. Came home on the plane, started feeling a little uneasy, got to the tarmac, and I knew I was sick. I got COVID. And what ensued was the worst 5 days of not eating or drinking. And at one point, Donna, on the instructions of the doctor, calls 911. And into the kitchen come 6 healthcare workers with the huge hazmat gear. And they sit down, and one looks at me and says, "Mr. Weston, when did you start feeling confused?" And I paused and I said, "Well, I think when I married her." And they knew I was going to make it. But there was an example where, we had community. I had family around me, great healthcare providers, and those of you who went through COVID or had friends or family members, you know how important it was to have community and resilience. So where does that bring us today in Canada? I mean, we are in a country that ought to be at the top of the world in terms of our resilience and our community. We have the lakes, we have the mountains, we have the trails, we've got the community centers, we've got educated people. So why in the world do we have the kinds of numbers that we see? We know that, well, first of all, let me ask you, how many minutes a week are people supposed to have to meet the minimum in terms of healthy physical activity?
180.
Close. It's 150 according to Health Canada, 150. Do you know how many of our youth hit that? Less than 27%. And guess what? A third of our youth are obese or overweight in Canada. And what does that mean? That means that an obese youth is 14 times more likely to suffer a cardiac event by age 50. Cardio disease, diabetes on the rise, especially in certain communities. People who are poor, who are homeless, who are drug addicted, First Nations suffer particularly from diabetes and cardio kinds of issues. In terms of mental health, I never heard about suicide when I was a kid. I didn't have any friends who were doing that. All of our kids, Donna and I will tell you, know of people who've taken their own lives. And just in the last few weeks, you may have read in the Globe and Mail about some jerk who's counseling people how to take their own lives online. And words like suicidicity are entering into the vocabulary, the trend towards thinking those thoughts. There was a report out of Stanford in the last month that said 50% of people under 40 have encountered some serious mental illness. And I think we're only beginning to understand the cost of COVID in terms of mental health as people were isolated. Our founder, many of you have heard of Jack Taunton, many of you are friends of Jack Taunton. He founded sport medicine in Canada. He was the top doc for Canada during the 2010 games. He started the BMO Marathon that was run again just a couple of weeks ago, and there he was firing the starting gun. You might have seen him. So Jack wanted to be here today. Jack has surgery today, so he's not with us, but he wanted to say something. So this is from Jack Taunton, a real hero for a lot of us.
As a board member of the Canadian Health and Fitness Institute, it's a tremendous honor to invite you to celebrate with us our goal of making Canada the fittest nation in 2030. It will be wonderful this morning to discuss the exciting federal grant for $235,000 that we have received to improve health and fitness for our Canadian communities. The other very exciting thing for me is to celebrate our Trail and Hut project, which we have now got started in Chilliwack, then we'll go to Mission, and you will be able to see the wonderful painting that's been donated by Scott Quiche that will be available for attendees, and we will ultimately auction off the original painting itself. So thank you very, very much for joining us. Unfortunately, I have another surgery on this journey and will be unable to attend, but I will be there in spirit. Thank you, Jack.
So that's Dr. Jack. If you know him, you love him, and if you don't know him, you should. At any rate, Jack would tell you that we as a country need to do better. And these are statistics that are generated by Participaction and a partner of Participactions. They tell you where we stand vis-a-vis other countries and how far we need to go to live up to our destiny. There's something about an unlived destiny that is really sad. And if you agree that Canadians are increasingly ill-equipped to deal with resilience, that our physical, mental, and spiritual health are declining, the obesity rates I just mentioned are twice the rate of a generation ago. Twice the rate of a generation ago. Look at the active transportation number. And now you may say, well, we have a big country, but we can do better in active transportation. and 12th for overall physical activity. Our goal is to improve on those numbers. And if you care about the finances of this, the cost of treating the results of physical inactivity range between 7.9 and $25 billion a year. That's billion with a B. And yet we can't get the government, for instance, to include in the Prime Minister's mandate letter to the Health Minister to make physical exercise a key aspect of our health. The acute crises occupy the headlines. And from my career in politics, I can tell you that the movement towards a long-term increase in physical, mental, spiritual health just don't occupy the mind space of our senior leaders. And those numbers, by the way, the $429 per taxpayer is the low end. So as we move up to 25 billion, multiply that by several times. That's assuming that each of the 18 million taxpayers are contributing their same amount. So where did CHFI come from? Back in January of 2010, just before the Olympic and Paralympic Games came to this part of the world, Nancy Green-Rain and I were on a panel at Park Royal in West Vancouver. The question in the panel was, what should be the legacy of the Games? The Games cost many $billion, and for that extravaganza, it occurred to me we ought to be looking for something beyond podiums and medals, and Nancy agreed. Her suggestion was it should be an increase in the health and fitness of all Canadians. So we created the Parliamentary Fitness Initiative. We got MPs running and swimming together on a Tuesday and a Thursday in Ottawa. We created marquee events on Parliament Hill like Swim Day and Bike Day and Ski Day on the Hill. And we came up with the idea of a National Health and Fitness Day, the first Saturday in June, inviting cities across the country to proclaim the day and get their people out. Why? Because the local governments own the swimming pools and the facilities, and they're close to their people and able to really make an impact. And happily, Nancy and I got a bill passed in 2014. It was called the National Health and Fitness Day Act. So in perpetuity, the first Saturday in June is National Health and Fitness Day. But for all of that work, all of those thousands of hours of activity, we couldn't point to one person who specifically had improved in their physical or mental health. And so CHFI was born. After I left Parliament in 2017, people in the room and others came together, and we created this charitable foundation. The foundation wants to change the culture of a nation. We have 35 directors and advisors. We're a charitable foundation, as I mentioned, so we can issue tax receipts. And we have an indomitable spirit, people who are not waiting for all of the funds to flow in to take on the challenge that we think ought to be taken, which is make Canada the fittest nation on earth by 2030. 2030 gives us enough runway to do the work, and it happens, it's also the year in which Canada is trying to land another Winter Olympic Games for West Vancouver, Whistler, and Sun Peaks. So there's a nice kind of a coincidence around 2030. So it was JFK who said back in 1961, ask not what your country can do for you, but what you can do for your country. And so our goal is to do what he did in creating the Peace Corps, which was to create a real national change, a different thinking about citizenship. And we believe with great partners like the ones in the room, thank you TELUS, thank you Rotary, thank you Sarasil, thank you Government of Canada, that we can do this. Our four-phase plan is quite specific. It starts with engagement with communities. And we're well on our way. We have a partnership with Strava, and this is where PS, our advertising firm, has been instrumental. Strava has 2.7 million followers in Canada, and we're going to be promoting National Health and Fitness Day, which is the second box in your slide, unlike it's ever been promoted before. Our aim is to get 100,000 identified participants this year, 1 million by next year, and 10 million by 2030. The third part of the strategic plan is the most ironic. Even though we can point to screen time as being a major source of sedentary behavior, we acknowledge that we have to have a strong digital plan and a strong digital presence in order to reach people in 2023. So our goal is to create this website that will bring in our sponsors for two reasons. The sponsors will get a bigger market share as they get exposure to the increasing movement of people who are engaged with CHFI, and they will live up to their corporate social responsibility goals. Meanwhile, individuals will be able to obtain concessions from the corporate sponsors while living up to their own individual health and fitness goals. So that's why this digital platform is going to be so important. And then finally, we expect to galvanize the nation through our hut-to-hut trail system. So more on that in just a second. Here's the Strava challenge. This is the creative that's been developed by PS, Patty, and her team. You'll see there's some nice flow there. And unlike any group that we know of, at least in Canada, our Strava challenge involves a strong Indigenous partnership. So we're working with IPAC, which stands for the Indigenous Physical Activity Cultural Center, led by Darren Warburton, who's on our board and teaches kinesiology out at UBC. So we're very strongly united with Indigenous partners, and these are some of the creatives you're going to see around the Strava challenge. This hut has been designed by Jay Bawa, another board member who was part of the team responsible for renovating Parliament buildings. Jay is a new Canadian, and only a new Canadian could do what he did in coming up with our logo. You've seen our logo, this figure jumping out of a maple leaf. I would never have messed with the maple leaf if I were designing an icon. And he did, because he's a new Canadian with fresh eyes and fresh spirit. And he's working with Aaron Paul and Sam Waddington, also on our board of advisors, to create the template hut. The idea is to get Canadians outdoors, because time after time, psychologists and doctors are telling us that being outdoors is part of being healthy. In a country like ours, why wouldn't you be outdoors? Being outdoors allows for more physical activity. And being outdoors allows you to invite your family member or your friend to go for a walk or a hike on a trail. And if you have these shelters set up around the country, then it's way more inviting. The country we think of often is Norway. Norway is famous for having outdoor shelters. Switzerland, other countries have done this better than we, and we're going to exceed them. We're not going to own all of these. We're going to design, and then we're going to welcome Canadians, communities, Rotary groups, and other communities around the country to build their own shelters and maintain them. And then ultimately, we hope to establish this National Adventure and Innovation Center, which will be a place to coach the coaches, educate the educators, and teach the teachers. So what do we need? Well, we do need more directors. We target 5 new directors by November, including an expert in communications, one in IT, and one in public-private partnerships, and another in fundraising. So and in total, we aim to add 5 new directors to our board. And in terms of our budget, we're delighted to say we're well on our way to our $1 million budget. We've raised $263,000 in terms of commitments and grants to date. And we fully expect to achieve our $1 million goal to cover our needs that will take us through the end of 2024. And that will be the true, let's say, professionalization of CHFI. We're proud that we have logged over 8,000 hours of volunteer time, and we'll always be a volunteer-driven organization. But we acknowledge that we do need to hire a CEO and an EA in order to accomplish the things that we're trying to do. We're grateful. Thank you again. We couldn't be doing this alone. This is truly about resilience and community means partners working together. You see some familiar logos on that slide. The one that you might not recognize is the blue Mandela-like one, which is the IPAC one. And the Canadian Healthy Communities Initiative, that's the Government of Canada. So thank you. Really appreciate your taking your very precious and valuable time today. Welcome your input. I hope you'll consider giving us feedback, helping us move along and galvanize other Canadians to do this. We would also welcome your donations. They're fully receivable for tax purposes, and we'd be grateful if you chipped in. Would love to hear your questions.